My name is Flora Muchirone Peluso. I am a child and youth worker here at Humber River Hospital.
My name is Melise Mitchell, and I'm a clinical social worker here at Humber River Hospital.
Due to COVID-19, students have been out of school since March. We were concerned that kids were at home and they were struggling with generalized anxiety, difficulty focusing, difficulty sleeping, and we felt it was really important to support the community, especially these adolescents. So we provided them with a workshop. It was a one-day workshop. We called it a booster session. And in that workshop, there were lots of activities. It was a fun day. We were outside, we were inside. We ran a meditation group. And during that meditation group, we basically taught them how to meditate to support their sleep hygiene, because that is mostly important when it comes to regulating and maintaining a good mental health.
We encourage the youth to get as wild and as physical as possible. We had them doing planks, we had them jumping rope, hula hooping, and after they were doing that, their heart rate was all elevated. From there, they had to complete a set of tasks with regards to sending themselves a nice little message, a positive message, on a really tiny sheet of paper, just to help them, use those fine motor skills. The obstacle course came out of an idea that myself and Flora had to get the kids outside and active. It was a partnered obstacle course, keeping in mind that we were practicing social distancing, and it incorporated a CrossFit-like feel with an AMRAP and skill testing questions. And the obstacle was designed that it was partnered, so while one partner was doing the activity, the other person was encouraging them and really cheering for them and rooting them on. And the whole idea about the obstacle was to get them to mimic the symptoms of an anxiety attack. So while their heart rate is up and pumping and the heart rate's going and the blood vessels are pumping and they're sweating, and then we got them to move on to the skill testing questions. So having to change that focus and use that cognitive ability to answer the skill testing question. From there, changing the mindsets to being able to write yourself a positive message on a small piece of paper, because then we were trying to use that fine motor skills. So it was a combination of using the large muscle group to get the heart rate pumping, and then changing to the cognitive by answering the skill testing questions, and then moving from there to using the fine motor skills, really taking a holistic approach and demonstrating that even in something like an obstacle course, they're able to get through.
The impact was phenomenal. Kids were enthusiastic, they were energetic, they wanted more, they requested a longer stay within the group. We were very impressed with the impact that we had on them on that day.
The kids expressed how different it was from a regular booster session. They really gave a lot of positive feedback to the obstacle courses and the different activities, just getting out of their comfort zone and trying something new, and the encouragement that they got from each other. We got a lot of feedback with regards to the incentives, the giveaways that day from our donors, the Super Sophia Project, who donated gift bags and all sorts of awesome giveaways for kids just to support them going back to school.